Hello, my name is Pritt Kallah and I'm a primary care facilitator for the Clinical Effectiveness Group, and I will be showing you how to use the APL-Renal tool for EMIS Web. Please make sure that you have downloaded the resources for the tool from the email you were sent and saved them onto your secure shared folder. Firstly, I will be showing you how to import, run and export the search results in EMIS. So to begin, click on the EMIS button, select Reporting and Population Reporting. Choose an appropriate destination folder to import the searches into. For this video, I will be using this empty demonstration folder. From the ribbon, click Import, then go to the three dots next to the side of the inquiry document. This will take you to your File Manager Explorer, where you can navigate to where you saved the APL-Renal tool resources. Select the searches XML file and click Open and then OK. As you can see, the search and report has been imported into the selected EMIS folder. The search is denoted by the magnifying glass and the report is denoted by a spreadsheet icon. Highlight the report, then click Run. This will run both the search and the report together. When ready, click Yes to confirm. You will know when the run has completed when numbers appear in the population count column for both the search and the report. When completed, highlight the report again and then click on View Results on the ribbon. When the report has opened, click the Export button, and in the pop-up box you want to select CSV and override hidden patients where possible. Click OK. This creates the CSV file of patient data required to run the APL tool. Now remember, this file contains patient identifiable data, so you must save it in an appropriately secure area. The file name pre-populates, but I would suggest that you at least put in the date that this was run in case you run it again. Click Save. And that's it. You have successfully imported and run the search and exported the results. I will now show you how to use the APL-Renal tool. Open the Excel file from the resources you downloaded and saved earlier. Once the tool opens, you will see that you have a choice of clinical systems. As I'm demonstrating EMIS Web, I've clicked on the EMIS Web button. Next, you will need to import your CSV patient list into the tool. To do this, click on the icon next to Press to locate CSV file. This will take you to your file manager, where you can navigate to the CSV file you saved from EMIS earlier. Because I'm doing a demo, I'm only going to be importing dummy data. The import has begun. Please note this warning in red and click the link if you need any further information. This tool enables clinicians to undertake a virtual review of patients by highlighting any overdue measures or any serious deterioration. So looking at the data in this tool, we can see that there are 800 patients. The tool naturally prioritizes those patients with the greatest fall in eGFR. But you can use these filters here to view particular groups of patients too. The filters allow you to select patients by their fall in eGFR, their latest eGFR, the urine ACR, BP, whether they're on a SGLT2, on ACE or ARBs, or on a statin, also by their CKD coding, and whether they have any comorbidities, i.e. CVD, diabetes, hypertension, heart failure, or AF. Note you can also look for patients that have got any of these missing from their patient record. You can also choose to select whether patients have had a referral or review after their latest EGFR. I'm going to select patients who've had a fall of 10 or more in EGFR. Once you've selected your filters, the patient count here will show you how many patients you have to review. In this instance, there's 112. If you wanted to, you could reset these filters by clicking this button here. Now we can look at the filtered patient list. Each column represents one of the filters above and whether there's any corresponding data from the patient's medical record. If you want to review any particular patient in more detail, you can click on the name and this will take you to a patient information tab. So the first section in this tab denotes the patient demographics, and this includes the patient's EMIS number. The next section shows a tabular and graph view of the patient's recorded EGFR, and this is for the last 2 years. As you scroll down, you can view the current CKD coding, then clinical data, which includes Q risk if recorded. The next section shows you other relevant risk factors and when they were recorded, followed by current medications, including dosage and when they were commenced. The pink highlighted areas you can see emphasize that the patient has a CKD stage of between 3 to 5, as well as another comorbidity. The final 2 sections show when, or if indeed if, the patient was last referred to the renal consultant and the latest GP review. To the right of the patient information, there are some useful resources, including a table to show the prognosis of CKD by GFR and albuminuria. Below that, you have some hyperlinks. They take you to the current guidelines, the kidney failure risk score, and also the NICE renal recommendations. If you scroll back up, you can see that there's a PDF button here. This allows you to export the patient information exactly as it can be seen, and then this can be attached to any referral letters if you feel a referral is necessary. To return to the main page, simply click the back button. Just going to quickly show you to the right of the filters box, you have a summary that were in the entire cohort. So of the 800 patients, those with a urine ACR 53% and so on. Now I will show you how to export lists of patients from the APL-Renal tool. If you would like to export data from the tool, for example to forward a list to a clinician for review, select your cohort by using the filters already shown. I will keep the filters I've already selected. Then click the Export Patients List icon. You will see a warning reminding you that you are exporting a list containing patient identifiable data. Click OK. Browse to the secure shared drive. Again, the file name is already pre-populated, but you may want to change it to reflect the filters that you have set. So in this case, we set it to EGFR 10. Click Save. When you open the file that you have just saved, you will see that it's been saved in the same format as the tool, and this can be printed or securely shared electronically. The other benefit of doing this is that if so wanted, the clinician could annotate to the side of the patient any comments or any findings. Going back to your Apple tool, you can also export to a CSV file that you can use to send text messages to patients using the Accurix text messaging system, or you can export NHS numbers to a text file that can be then imported back into EMIS. You may want to do this latter option if you prefer to send out batch invitation letters. In all export options, you will see the message we saw earlier, which will remind you that you are about to export a file containing patient identifiable data. Finally, please do remember to name the file appropriately for future use. Thank you for watching this video.